Hey everybody, my name is Joshua Hancock. I'm a licensed physical therapist assistant here at Orthopaedic and Spine Center Physical Therapy. And today we'll be talking about how to avoid low back injury while lifting objects. Every day, there may be something that we have to lift or move around, and it's good to know proper body mechanics to be able to protect yourself from doing that. So we'll talk about a few points here. The first point is body position. Now, when you lift a load, for example, like the one we have here, you want to get that body as close as you can to that load. And you can do that by bringing the midpoint of the foot right by the midpoint of the object. Now, if it's an object that happens to be a little bit bigger and you can't get your feet around it, you can do a staggered stance. That way, you can get your body as close as possible. The second point is your breath. When you lift something, it's good to take a nice deep breath and give it a hold. That goes against conventional wisdom in the physical therapy world, but when lifting things in particular, it's good to take that deep breath to help stabilize that back and keep that back straight. Now, a straight back is a strong back. So you can take that big deep breath in right before you go down to lift it. If you have any uncontrolled blood pressure issues or diagnosis of aneurysms, then definitely don't hold the breath. So next is the squat depth. Now that I get nice and close to it, take that big deep breath. I'm going to go down into a squat. So the goal here is to not squat down as far as possible, because that will loosen up the back. And once again, a straight back is a strong back. What you want to do is you want to come down with a nice tight core and straight back just to where you can get to the load. Right there, once again. And push through your legs, keeping that load as close to you as possible. Now the key here is to make sure that you sit back as you go down to pick up that load. So I'm going to sit back and pick up that load. And that keeps my back in a nice, straight, neutral position. Still holding my breath, I'm going to press through the legs, bring that load nice and close to me, and carry it close to my body. Now the fourth point is, once I've got it up here and I move it, what I want to do is I want to use my feet. A lot of times if we're just moving something from here to there, we might twist, and that increases the chance of injury for the back. So if I want to move something from